Hi, I am Dr. Edna, gynecologist and specialist in fertility treatments. As you may know, we are in March, and in March we take conscious about endometriosis and the women that are struggling with this type of pathology. So because of that, we think that it was a good idea to perform this clip information video for you to try to explain all this disease and how is endometriosis related with infertility. First of all, let's define the endometriosis. Endometriosis is the presence of endometrial tissue outside the uterus. Okay, how common or how does the endometriosis is presented in the woman? Okay, so if we talk about, for example, general population, we can find out that around 2 to 10% of the women are going to be struggling with this type of disease at some point of their life. We have to take in consideration too the infertility patients, and actually if we count them, we will find out that around 50% of the patients that are struggling with any type of infertility issue are going to have any type of stage of endometriosis. So it's quite common around the world. So what are the symptoms, or how can we suspect that we are struggling with endometriosis? The most common symptom that the patients have is the dysmenorrhea. Dysmenorrhea means painful menstruation, okay? And there are a couple other of symptoms that a woman may have. For example, they may have nausea, migraine, also they may have infertility, fatigue, or also any other type of symptoms such as a heavy bleeding menstrual and many other symptoms. If you present this type of symptoms, and please go and search for help with your general practitioner. If you can go directly to an OB-GYN, it would be better for you. So what causes endometriosis? Okay, so unfortunately, it has not been yet defined the specific cause of endometriosis. Throughout all these years, it has been proposed in different type of theories that may explain this disease, and the most accepted one is the one that explained the retrograde menstruation. That is that instead of having a menstruation that is going to be eliminated throughout the vagina, most of the cells that are going to throughout this way are going to go retrograde throughout the fallopian tubes. This is a way which the cells are going to be inside the pelvis, and because of different type of molecules, they are going to get stuck throughout the organs that are inside the pelvis, meaning the ovaries, the tubes, the bowel, even the bladder. So that's the most common theory that explains the endometriosis. How can a woman may be affected with infertility and endometriosis? Well, so we don't have to forget the specific cause of the endometriosis, that is the presence of these cells. So whenever we have these cells in the pelvis, these are going to be hormonally sensitive tissue. That means that every month, because we produce estradiol, these cells are going to produce different inflammatory substances. They are going to produce bleeding inside the pelvis, and this is going to produce an inflammatory chronic environment. This inflammatory environment is going to produce also some type of adhesions and scars inside the pelvis, and these adhesions and scars are going to produce that all the organs get stuck throughout each other. So sometimes this produce, for example, blood tubes, or the presence of endometriomas, that is a specific cyst inside the ovaries containing blood that actually may be increased in size, and that be very painful. So what are the options for the patients that are struggling with endometriosis? Well, that depends on the stage of the endometriosis that we are struggling with. So for example, if we are looking for a pregnancy and we have a stage 1 or 2 of endometriosis, we may choose to perform an IUI treatment. This will increase the probabilities to having a pregnancy quicker as if we were not performing any type of treatment. But for example, if we are struggling with stage 3 or 4, then we may have to give some of the patients any type of hormone treatment, and then after that going through an assisted reproductive technique. Most of the other times we will not need to give any hormonal treatment, but we are going to for sure get inside an assisted reproductive technique. In the other hand, if we are a patient that we're struggling with endometriosis but we are not looking for a pregnancy, then we have more options. We can give you hormonal treatment, and we can choose oral pills with progesterone, or even an intrauterine device that can help us to release progesterone hormones that actually may stop the endometrial receptivity of this tissue that is outside the uterus. Or for example, we can give you antagonists of the G and RH hormone or aromatase inhibitors. I hope that you find out this video informative and helpful. Please, if you have more questions, feel free to contact me. You can write me down, you can call me, feel free to do so. And maybe if we find out that a lot of patients have questions regarding the endometriosis, we can even schedule down a live video to explain to our patients all this disease. Okay, so take care and bye-bye.